Sacroiliac instability can be a cause of temporomandibular disorders not clearing. And so, I'm Dr. Keila Nichols. This is my son, Dr. Jesse Nichols. We just play all day together in the clinic, and it's really fun. So everybody knows, y'all probably know this is your sacroiliac joint right here. Here's your sacrum, right? Your ilium, okay? And so this is the joint in between. And you can imagine that this is like the fulcrum that holds everything upwards stable, okay? Everything sits into this fulcrum here. And so if one of these sides were to fall away, you couldn't hold yourself up, okay? And so there's this whole domino effect that happens when you interrupt the stability of one or both of those sacroiliac joints, okay? The body is willing to do whatever it can to hold you together because you would just crumble, if you didn't have both of those joints holding you up. This ends up, this whole domino effect going up your body to your TMJ, okay? So we're going to talk about those details so you guys can recognize it, and if you see it in the clinic, you can be like, oh, she talked about that. This person, I recognize that. Alrighty, so a sacroiliac separation, like I said, is when the ligaments that hold this joint together, these two bones together, they get overstretched or they get weakened for some reason, and the joint doesn't fit so nice hand in glove as it does here, and it starts to slip down. Or it'll slip one direction or slip another direction, but it's just like the glue is not holding it tight, right? Okay, so that's the joint right here. And if you fall on your bottom and you hit right here, right on this sit bone, that's going to cause a shearing of this joint. A lot of it happens in grade school. Yeah. You pull a chair out from under them, you fall out of a tree, you fall out of a swing, skating, skiing, you can think of all these things. Childbirth, your ligaments are all already kind of overstretched, and sometimes just pregnancy. Your ligaments are all loose and goosey in there, like they're supposed to be, so the pelvic floor can open and let the baby through. But sometimes it gets so loose that it drops down and misaligns. And the way those joints fit together, it's a pretty big joint. It's the biggest joint in the body, and it's got these grooves. And the way it fits together, if it slips down out of place, then it's hard for the body to pick all that up and get it back in place. Whereas if your neck misaligns or your mid-back, a lot of times it can find its way back and everything, but this is such an important joint. It's a weight-bearing joint, and it's got so much on it that it's hard to pick up your body to get it up against gravity and set it back in. So these can often be long-standing issues, Yeah.
And another point on the childbirth situation is that, you go through childbirth, everything spreads and comes back together, and oftentimes with like a cesarean or something like that, where you're bedridden for a while afterwards, you're not able to get up and move around and get everything back where it's supposed to be normally, while that relaxin escapes and leaves your ligaments where they were. So if you're in that situation, you can end up with, like in my wife's case, she gave birth, she was bedridden for a while afterwards, and she wasn't able to get up and moving and get everything back where it's supposed to be before the relaxin left, and then she was unstable until she had the next kid, and then we were able to get her back to where she needed to be, and then she healed back where she was supposed to be. So
So after birth is an excellent time to come in and just get this taken care of, because you want to heal in the right place. Yeah, good example. Hey, just pipe in anytime, no problem. Yeah, and you can imagine even in this position, you're pushing, your pelvis is held steady by the bed, but you're pushing down, and you can imagine how that shearing can happen in that case too. So there are a lot of things that can cause it.
We're meant to push on all fours, right? We're not meant to be pushing on our backs.
In birth, you just get the baby out the best way you can, but there are certainly easier ways.
Yeah.
Easier ways. Gracie was born in a hot tub, and I had a lot of trouble thinking, how does that? It doesn't fit with nature, But then I tried it. I'm like, I don't care about nature. That was a lot easier. My pelvis did a lot better. The buoyancy was good. So how does this present? How do you see this? Okay. What are some symptoms you might see? Well, of course, sacroiliac pain. You know, if they say they have low back pain, you're like, well, is it across here? You know, is it both sacroiliac joints? Is it one? Is it like right here? Anytime they come in, they're like, it's right here, then you're like, okay, we pretty much know what direction we're heading. So you just imagine you've got one side that's unstable. So, you know, say it's the right side that's not stable. And so you're going to stand on the left side, put your weight on the left side to give your right side a break. But that's going to get tired and complain, so you're going to go over to this side for a while until that starts complaining. And then you're going to go over here. Yeah, exactly. And so so you're going to see this dance all over. It's a really common thing. And so, you know, you're going to see this all over. But if you're standing at a concert or somewhere, you're going to see low level of it. If they're standing both legs, they're going to sway back and forth. Interesting.
The number of people that you're going to see walking around, you know,
You're going to see it everywhere.
You're going to see it everywhere.
Yeah. So you can't unsee it now. Yeah.
Same with mouth reading. I see everyone, and I'm like,
Right, exactly. I know, we do that too. All right, so how does the body try and keep you upright so that you don't just crumble, all the dominoes don't fall? All right, so in front, what's going to try and stabilize the front of your sacroiliac joint to just keep you upright is the psoas muscle or the iliopsoas muscle, but it's mostly the psoas part. And so that muscle attaches, you know, at your hip, your leg, and it goes up through your back, through your abdominal contents are behind them, and attaches to your backbone. So it's like an inverted V. Starts in front here, ends up in the back, you know, at my backbone, okay? That muscle attaches to the vertebra, of course, and so if it's tighter on one side or the other, it can pull those vertebrae around and misalign them and start the beginning of a scoliosis, okay? It also attaches into the discs, so if you're walking around with a tight psoas muscle already, and you go to pick something up really heavy, you know, so the psoas does this, it bends both sides, or it can bend one side, you know, you come in like this if it's really tight. If it's tight, first of all, if it's tight, when you sit down and you start to get up, you're going to be like this, because you're trying to lengthen that muscle, right? Okay, so when you feel that way, oh my goodness, you do.
It's me.
Can we just move to the treatment room? No, if you feel that way, you want to do psoas stretches, which we can show you, or you can look them up online. Because if it stays chronically tight like that, and you're feeling like that a lot, and then you go to lift weights or lift something, it's going to pull really hard, like my last-ditch effort to tighten up even more, and it can pull the discs out into a herniation or a bulge, either one. Yeah.
Anteriorly, or?
No, it's anterior to the side. Mm-hmm. Yep. This direction. Kind of depends what position you're in when you're lifting.
Okay.
Yeah. So it can, you know, fixing this is an easy thing, but not fixing it can really create a domino effect of other issues. Yeah. So here we have it pulling the vertebra around. So yeah, so it can cause a herniation, which can compress the nerve and cause sciatic pain, or it can cause just a general bulge that, you know, either one. Sometimes you don't get the pain until that herniation taps the nerve. If it's a bulge, it's going to be more, you know, you're going to have the pain more frequently because it's just always bulging. Okay, and that muscle also attaches to the base of the diaphragm. So your diaphragm is like this umbrella here, right? And you've got your stomach underneath it and the esophagus coming through.
It's all the way up to...
Yeah, it attaches into your diaphragm, into this part of your diaphragm.
What level is that?
T11, 12. T11 probably.
Wow.
11, 12, yeah.
You always think on the psoas just like going down and...
Right.
I know.
It's just right there.
Yeah.
Yeah, well, it's got different parts.
There's
Yeah. Isn't it fun?
So
Anatomy's so fun.
we always kind of think like, oh yeah, you know, organs are in there,
Yeah.
but they're right there.
Yeah, it's just
It's
like,
like-
that far in. So anyway, when that, say, your left psoas muscles is tight, you got your diaphragm, you got your stomach here. If that left psoas muscle is pulling down that diaphragm, what's going to happen? You're going to get a hiatal hernia. Because the diaphragm's being pulled down, and the stomach is going up, and that cardiac sphincter is not able to close. And so the contents is going to...
Yeah. Well, everyone's walking around with a huddle.
Mm-hmm.
And you know what? We just pull it down. I mean, it's just right there.
Yeah.
You don't have to surgically close. You just get in there.
Pull it down.
It's just right here.
And you
Just pull it out. Another thing that happens, so in the back, the muscles that are going to stabilize the back of the sacroiliac joint are your paraspinal muscles, okay? And they come up and they attach into the ribs. So we see a lot of rib misalignments with these, we call them category 2s, the sacroiliac instability. And it's trying to lift you up from the back, hold you up, okay? Hold that sacroiliac together and up. And so when it gets tired, though, it starts pulling down. And you start feeling this. Like one side is tighter than the other, and this is just killing you because the unstable side, those muscles are getting tired and they're pulling down. And where their symptoms are kind of tell us where they are in the dominoes. You know, how far along are you? How well is your body compensating? Another muscle, actually this attaches into here too, but I just tried to find a picture. But your lats, you know, they're trying to hold your pelvis up, hold all this together, right? And when that gets tired, it's going to pull down, you know, here. It's going to pull down on your shoulder. So you're going to start seeing shoulder dropping down. And as we say in the clinic, your coat hanger is not hanging straight.
Yeah.
And so your extremities misalign because they're not hanging straight. They're not meeting the way that they should. So we see a lot of extremity issues with it. And then the next muscle that comes to the rescue is going to be your upper traps. You know, it's pulling down here, right? And so your upper traps are going to try and lift you up and counter pull. Okay? And so the upper traps and the SCM, there, you know, this pulls up, and this is, you know, and this lifts up the front of your shoulder area.
Shoulder girdle.
Thank you. And counter pull. So we know the SCM attaches to your mastoid, okay, and the upper traps attach to the back of your head. And so what is that doing? Is it's pulling that down here now. And what is that going to do to the temporal bone? It's going to rotate the temporal bone back. So this is how it moves on up to the TMJ. Okay? So, it pulls back on that temporal bone. And so your masters and temporalis are literally trying to hold you up. So these are going to tighten up. It's kind of the last straw. And so if you're walking around weight-bearing, because the sacroiliac joint is a weight-bearing joint, when you're laying down, it's not as big an issue, okay? But when you're weight-bearing, this is really holding you up. And people are like, I'm trying not to clench. Well, you're clenching for a purpose. You know, the body's doing things the best it knows how, and it doesn't just randomly do things. So, but we know a lot of things can cause clenching, you know, parasites or stress or bite disturbances, all kinds of things. But this is one thing that you kind of now see the indicators, how you can kind of see if does this fit in with the cases or not. So this is tight, going around holding you up all day. Then at night, when you're finally not weight-bearing, so your head's been held in this vise all day with your masters and temporalis, and so it's not moving, you know, all the cranial bones are supposed to move and move cerebrospinal fluid, so it's inhibiting that. So at night, your body, in a survival mechanism, says we got to get now movement, circulation into the head, and so your masters and temporalis will start to do this to get circulation and movement into your skull, but that's also making you grind. So is this interesting? One thing leads to the next thing. So did you guys know this already? Yeah. Familiar.
You did a good job of
Yeah,
putting
I
it
do.
together for us, because I usually tell patients, this is the last thing to bother you. There's
Yeah.
other things wrong with you. We're starting from backwards. We're going to where the origin is. So.
Kind of squeezing the toothpaste tube up to the very little.
But people come here from the joint, and they go, how come I'm not getting better? When I told you to go see your physical therapist,
Yeah.
or, you know, a chiropractor.
Yeah.
And then they would go like, But I don't need the supplies.
Yeah.
But you're-
My jaw's not
you
down
already-
here.
Yeah, you already destroyed your joint, so we gotta protect that now too.
Yeah. Exactly, because then it destroys their teeth and their bite
Their
and their
occlusion,
TM joint and the disc and all kinds of things then start happening.
And then he starts shifting. So they
Yeah,
hold up.
because, if this side's
One
tight,
side collapse.
yeah, teeth shifting in and yeah. So fun. Okay, oh, and then, so it can pull your jaw over, you know this. And so your pterygoids come to the rescue. Internal on one side, external on the other side, and then pretty soon they're just all four tight. And then it just kind of shifts on around the other side. It just kind of goes full circle, and you have this safety pin cycle. Yeah.
I have a question.
Yes.
So we see a lot of people with a lot of hypermobility.
Where?
At least half of the
In-
patients I see have Ehlers-Danlos syndrome.
Yeah.
So they have joint hypermobility syndromes, Ehlers-Danlos syndrome. So their SIs are so unstable
Yeah.
with them, unless they're postpartum.
Mhm.
A lot of women are like, oh, postpartum, this one started.
Mm-hmm.
But we'll see some men with super hypermobility.
Yeah. Okay, I have so much to say on that. Okay,
That's
let me
another
just
talk.
narrow it down.
Yeah.
When I see hypermobility,
Yeah.
I always wonder about gluten and candida.
Okay.
And because a lot of it is an autoimmune issue. We're going to talk about this in the last class that you're taking with me.
Yeah. Today's
Yeah.
the first day, right?
Yeah. So, leaky gut syndrome, just the highway answer is leaky gut syndrome. You got these leaks in your gut. Food that's supposed to stay in your gut and be digested and broken down and move on through is getting out as macromolecules in your body. Your bloodstream, into your bloodstream, your body's not recognize it, tags it an allergen or an invader. And every time you have it, then your body attacks. It resembles the joints synovial fluid and the ligament structure of your body, as well as other things. And so not only does it attack then that molecule every time it comes in, it starts attacking those structures that are similar. So autoimmune condition.
Which is what we see in our patients. Because they will almost always have gut dysfunction that led to some mast cell issue, and now they're loosey-goosey, especially our teenagers. Are very loosey-goosey.
You're going to love my last class. If you can come live to any class in person, the last one, so good. Bring Dr. Krish. She'll like it too. Have her just kind of listening over your shoulder. So when those masters and temporalis muscles get tight, it just jams all the sutures because the temporalis muscle really fans back and it touches every one of these cranial bones. So it just pulls the suture super tight. So what's the way back? I'm going to simplify what we do as much as possible, but is not popping the joints because it's open. I mean, sometimes we need to pop it, you know what I mean, to reset it, but then we want to stabilize. But sometimes there's no popping going to happen in there. It needs to be reset and stabilized. And, the glue adhere, and stick. So we'll often put them in a sacroiliac belt to help it just kind of hold in place till it can adhere and heal. The belts are so great. They're so great. And we use these, you've seen those wedges maybe in my clinic. They're like little blocks. It's an SOT technique. And we close the joints up with those blocks.
It's a prime technique for Ehlers-Danlos.
I don't know any other
hypermobility
technique that
techniques.
addresses this good. Because it's not all popping. It's stabilizing.
So they're saying like this. You're
Yeah.
not like shearing into things.
Oh, she brought lunch. Where are you
In
going?
front again, almost. You don't have. So the wedges, you help put it
Close and stabilize.
close and stabilize.
Reset
And
the
then
joint.
remove the belt.
Yeah. Yeah. And then, we
So
correct.
It's not as simple as that.
It's not as simple as that, but it almost is. It almost is as simple as that. And then, we got to correct the misalignments and loosen the muscles that are like holding them for dear life
And then there's
so they can let go.
cranial aberrations
And then
that
we-
are connected to
ex-
it. And
Yeah. So you want to talk about sutural a little bit? Or?
yeah, so with this condition where the muscles are clenching everything down, one of the techniques we do is a TMJ sutural technique where we go in and we open up the sutures to kind of give the cranium a taste of this is where you want to be freedom.
Yeah.
This is here's closer to function. Let's get there. But the touchy thing is you can't open it up when that's what's holding their body up. So you open it up, you give them a little direction, and then you kind of close them down so they're stable again, and you're also blocking to make sure that their pelvis is stable so they're not just going to, you're not going
Fall
to
apart to puddle.
pull the rug out from under them and have them just domino collapse,
So stabilizing it, then it's safe to start opening this up little by little, loosening this up. So we just kind of have to, like you do, we have to, work it backwards until we get stability. And it's so great. And really in pregnancy, having your pelvis stable is really important, because if it's slipped back and the pelvic basin, is not
like
that.
It's
and
closed. That's a hard birth.
Yeah.
You want to be
Yeah. And or even it can sometimes the baby can't turn because the uterus is being tugged. Yeah, and it doesn't have the room to make that
What
turn.
happens if somebody has like a hip situation where they play sports and all, and a hip is kind of out of whack, and they get pregnant? So what happens
Well,
to that?
we've been through that.
Yep.
Yeah. Well, you just got to treat everything that you find. So we'd work on all the muscles that are attached to the hip. We give some decompression into that hip.
While they're pregnant?
Yeah. Oh yeah. Oh yeah. Pregnant mamas need it, but really after birth mamas really need it too, because So yeah, we just make sure the muscles holding the hip are the appropriate tone. They're not too tight and shoving it into the joint and creating joint deterioration, and they're not so loose that they can't hold their alignment. So we find the ones that are too tight, we loosen them. Find the ones that are too loose, we tighten, stabilize, give them nutritional support to make those ligament, the collagen and stuff like that, to make sure
What
that
nutrition support?
collagen. Or we use a lot of cell salts, homeopathic cell salts. So we probably give them calc flor, calc phos, things that nourish the ligaments and the connective tissue. And give them some exercises. Definitely want to make sure that psoas is loose, because it attaches to the front of the leg. And if it's tight, it can just pull it in. It can pull it in at a weird ankle. And we just treat all the stuff. I mean, there's even more, like how it affects your knees and your ankles. And I mean, we could do a whole weekend. There are whole weekend seminars on this. Yeah. But I like the way you're like thinking next thing, and well, that could affect this, and how about this, and
And a
that.
patient first.